So I'd like to do another little tip or trick or little pearl to go into, and it's pretty much dealing with evaluations for your patients and who's a really good patient for a thread lift. And Susan's had multiple thread lifts and she's overdue, and it's time to lift her back up again. And you can see she's got this prominent jowl that we really want to take care of, and she's got a little droop down in this region that kind of really bugs her. But you have to be careful, because when you look closely at Susan's jowl, bend forward for me a little bit, she does, when you bend her forward, see how it forms a little bit more, but come back again. But it's really not as much that it's that fat pad that's dropped. She's actually getting this squaring off of her mandible. See how it goes from here, and this is firm. So she's got this angle now where she used to have a nice smooth curve. And part of that is a result of osseous loss and fat loss here, but mostly osseous. But if you look at her chin width is now increased. It should be about the same width as the inner canthals of her eyes. So we're going to go later, we're going to put a little filler in the chin, and you can see just by doing a little filler in the chin and pulling forward, that's going to help us. And we probably will add a little filler here. But we always want to do our threads first, so we're going to lift her first. Now, we do this little trick to help us determine whether or not a lifting thread is going to work. And we picked where our area is that we have our anchoring or insertion, and that's along the zygomatic arch. So right around in here is where I expect from you to go in and anchor. And I take my finger and I go 1 finger's width below that site, and I look at my jowl and I pull up. And that corrects it on Susan. And I look at her nasolabial fold, 1 finger, and pulls it up. If 1 finger is not enough, then I'll use 2 fingers in front of it and pull it up. And that's more than enough for Susan. If, however, it takes me 3 fingers to pull everything up, that is not a good case for PDO threads. Those are the kind of cases that you basically want to refer out, or sometimes you can resort to my old buddy here and take care of it as well. That helps quite a bit.